Chronic care management is a great new Medicare program, improving care for patients with chronic conditions and making it financially rewarding for medical providers to participate. This video will go over the requirements and payments to help you determine if you should start your own in-house chronic care management program. To participate, you must have a certified electronic medical record with the ability for patients to use it for communication with your office. Patient consent must be documented, although this does not have to be done in person for patients who have been seen within the last year. The monthly $43 Medicare payment is subject to copayment and deductibles. Thankfully, many patients have secondary insurance policies to supplement their Medicare and cover these costs. I've seen estimates that approximately 30% of Medicare patients have such policies, but it can be much higher in some regions. I find it easy to convince patients to sign up if they have a secondary insurance that covers their copayments. I simply ask, do you have to pay a copay when you come to appointments like this? If they don't have to pay for the visit copay, they won't get charged for the CCM monthly copays. The program requires that patients have 24-hour access to address urgent needs. If you don't already have call coverage for your patients, this will be a necessary new service your office provides to be CCM compliant. You also need to know that this program takes up a significant amount of time for your office staff. Our office had to hire a medical assistant dedicated to CCM calling. We found we had to create a dedicated position because our MAs would usually be pulled away to take care of other duties that came up in the office, keeping them from starting new CCM calls. An additional medical assistant means there is a need for dedicated space not currently used for other purposes, a dedicated computer, and a new phone line. These are all expenses you need to consider. Plus, providers are going to be spending time reviewing and responding to CCM encounters. Don't worry about that time though. It will be made up for through the decreased frequency of time-consuming in-office chronic illness management appointments. A 2015 study in Annals of Internal Medicine found that practices that rely on non-physician team members to deliver CCM services will probably experience substantial net revenue gains, but must enroll a sufficient number of eligible patients to recoup costs. At a minimum, 131 patients must enroll for practices to recoup the salary and overhead costs of hiring a full-time RN to provide CCM services. That number of enrollees needed will be lower if a high-performing medical assistant is used instead of a registered nurse. It's a little tricky estimating how many patients you will complete with the requisite 20 minutes in a given month. I've heard of commercial CCM services estimating rates of 30% and one claiming they will get you 60% efficiency. Doing a little math finds that you would need 1,000 patients enrolled to keep a full-time staff member occupied if exactly 20 minutes is spent monthly with 50% of these patients. Most full-time primary care providers will have somewhere between 150 to 300 Medicare patients with a supplement that covers CCM copays. Group practices with 4 or more full-time providers will need at least a full-time position for CCM once most eligible patients have been enrolled. In addition to the monthly payments of around $43 per completed CCM per month, there's also a one-time enrollment payment of $64 when a provider personally performs an extensive assessment and care planning in addition to the usual effort at an office visit. This care planning is facilitated by CCM Pays care plan templates. There are a number of commercial CCM providers who will gladly partner with you to provide CCM to your patients using their call center. They take anywhere from a third to half of the $43 monthly payment per completed patient. There are also software-based programs meant to help with in-house CCM. They usually charge around $1 or so monthly per enrolled patient, whether or not a CCM charge is generated. If you'd rather keep care in-house with a staff member who is a part of your team, and you don't like monthly costs, consider using CCM Pays Toolkit. It includes instructional video and over 24 pre-made monthly care plan and monthly management templates covering the most common chronic conditions of Medicare patients. It can get your office up and going for a one-time payment of less than the Medicare reimbursement for signing up 3 new enrollees for CCM. If you think this is right for you, let's get started.